are here at the Greater New York, and you are one of my idols for many, many years. This
Howard,
is
the feeling is mutual.
This is Dr. Tom Hirsch, who's actually the dentist inventor of Isolite.
Isolite Systems, yes, I am.
And Isolite is very interesting because I don't know if it's just because I'm 53 and I have to use readers, but you know, at first you start using magnification, and you do a lot higher quality dentistry when you do magnification. Every endodontist will say when he looks through a microscope, the quality went higher.
Absolutely, it does.
But labor, having the assistant try to retract the tongue and suction all the time, and so you built Isolite, which is a retraction device, but flooded the area with light so you can actually see with your loops. And what my assistant, I've had the same assistant for 20 years. My first assistant was Jan. She's still there 20 years later. What she loves about the Isolite is, instead of just standing there retracting and suctioning, when I'm using the Isolite, she says it's better isolation. It's flooded with light, you can see, but she can be entering the nodes, sending it. She's working instead of just standing there. And this was all because of you. So tell us the Isolite story.
Well, Howard, you know, you can effectively use your team with Isolite, which is really nice. And how this all came to pass was based out of need. For me,
what year? Take us back.
Year is 1985. 1985, I came up with this crazy idea. And this is when fiber optic handpieces first came out. And the way this whole thing was born was quite interesting. I got one of the first fiber optic handpieces. It was Midwest American's fiber optic handpiece. It had a light box. It had this long cable that, for me and my operators, used to drape across the floor. And I love the fact that I could really see what I was doing in the mouth with the light from the end of the handpiece. So I was proud of my work. I did a great job. I'd sit there. I'd push the chair back. Bang, bang. I'd roll over the fiber optic bundle. I said, oh, that hurt. And I'd look at it, and I've immediately lost half of my fiber optic bundle. Then I bring the chair back the other way, and the whole thing was gone. I'm just stupid enough that I couldn't train myself not to roll my chair or my fiber optic bundle. So after the first 6 fiber optic bundles at $300 a pop back in 1985, it's maybe equated to $1,000 today, I said there's got to be a better way. So one day I'm looking in my operatory. Light box is over there. Patient is here. Light's there. Patient's here. Why is the light there and the patient's here? I'm going to put a light inside the mouth. So that's how it came to pass with the idea. And so I talked to my brother, and I said, Jim, and he's an industrial designer.
And he's Tom Hirsch, too.
He's Tom Hirsch, too, but his name's Jim.
Okay, your brother's Jim Hirsch.
Yep.
And his wife's the one...
his wife is now our CEO of the company.
Right.
That's
What's
Sandy.
her name?
Sandy Hirsch.
Sandy Hirsch. And I love her to death.
Oh, she's a doll.
She's been adorable for 20 years.
You know, she has been...
And I'm sorry, I actually thought that was your wife.
Nope, not my wife.
But that's your brother's wife.
That's my brother's wife, yeah. So she runs the company, keeps us solvent, and made sure that we got through the hard times. She did a great job. I mean, she can squeeze a nickel so hard that you know what happens there. And she does a great job doing that, which actually got us over the finish line to the goal line where we, made a great touchdown. I've loved Isolite, and it's worked well for us. So that's how we got the light inside the mouth, and it came over Thanksgiving dinner 15 years ago when Jim came in, and he comes with this light in a block of acrylic with wires hanging out the end of it. We plug this thing in. It's in his mouth because he shaped it to put his mouth. Plugs this thing in. Light is flowing down from the roof of his mouth. And that lasted for about 30 or 40 seconds till the acrylic got so hot that it scorched the roof of his mouth. He had this massive pizza burn on the roof of his mouth. So that's how it started. And from there, we expanded it out to incorporate the light into a bite block, into a tongue retractor, and a throat retractor, and a cheek retractor.
So I want to ask you, and Hogo, I wish you would join in this conversation. You know how humans are very extremists. They don't seem to be moderates at all. And every wise, great man that ever went before has always said, moderation is the key, moderation is the key. But most people are just extremists. There are people who believe that they've heard so many times you cannot do a posterior composite without a rubber dam. And then when you tell them Isolite, it's like, it's not a rubber dam, so their mind just like, meh, 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 or you can't do a root canal without a rubber dam. And so I'm going to ask you two great minds. Do you think you can do a posterior composite with an Isolite and not a rubber dam?
I did for like 10 years. I just was never a rubber dam guy, but I needed isolation because I'm one of those guys that don't do amalgams. I do old composites and CAD-CAM.
Yep.
And Isolite saved my life.
So do you think you can do a posterior composite without a rubber dam with an Isolite?
Not only do I think, I do them on a daily basis, and they work well. As long as you keep the area isolated, you keep it dry, you're going to get great results with your composites. If you get any moisture contamination, it's going to fail. It's in the toilet. And that's just the way it is. So it's got to be dry.
But do you see the mental error of some of these people that just like, well, you have to have a rubber dam, and you get on Dental Town and say that if you did a posterior composite out of rubber dam, that you're like a bad person.
Well, herein lies the beauty of this whole thing, is that we are now, Isolite is now in a number of dental schools across the United States. A few years back, I made the decision to donate 2 Isolites per chair per school to every school in the United States. So we made a massive donation.
God. How many was that? How many dental schools are there? 56?
There's 60 dental schools in the United States right now.
60 dental schools right
There's
now.
new ones that are coming up as we speak, but there's about 60 schools in the United States. So what we did is we divided them into 3 tiers, because I can't outfit everybody all at the same time. And so we divided them into 3 tiers, so now we can go to the dental schools, and we gave them the offer of a free ISOVAC system, not the Isolite system, but a free ISOVAC system. That's the one that doesn't have the light, that plugs right into the end of their HVE hose.
It does not have the light?
Does not have the light, goes right into their HVE hose. And so they get 2 systems per chair per school. So if a school has 500 chairs, they can have 1,000 ISOVAC systems. And that way the students can get trained on this, and really it becomes the student's dental assistant. And you know what it was like in dental school. You're fumbling. You don't have enough hands to do everything.
A 1-week rotation with the dental assistant for the whole 4 years there.
And so this is just like having a dental assistant for the student. It makes it really nice for them.
Okay, talk about chair viewers. Talk about, because a lot of the international too. Every single country on our podcast, every single country that iTunes measures gets checked off.
Okay.
What is ISOVAC? What is a Isolite? How much are they? How do they buy these? What is the website? Talk specifics.
So specifically, we have 3 different systems. Our premier system is the Isolite system. We then have the ISOVAC system, and our third system is the ISODry system. The
ISOVAC, ISOLite,
and
ISODry.
Okay. Okay. The Isolite has all the bells and the whistles. It's got the light. They all utilize the same mouthpiece, so functionally speaking, they all evacuate. They have a nice soft bite block that keeps the mouth open, keeps the tongue out of the way, keeps the throat obturated so nothing goes down the throat, protects the cheek. In the last 14 years, I've not cut a tongue or a cheek or dropped anything down the throat.
So you're saying it's good enough for endo too? They're not going to swallow an endo file?
They will not swallow an endo file, but my position on endo as a company is that standard of care dictates that we use a rubber dam when we're doing endodontic procedures. That's just standard of care. So as a spokesperson for the company, that's what I maintain. Now, that being said, a lot of dentists do endodontic procedures without a rubber dam. If you're not using a rubber dam, you have to have something that will protect the patient's throat and keep them from swallowing the sodium hypochlorite and or hopefully not a file. And the Isolite will do a good job at that, but that's not what I recommend it for.
Okay. Yeah. But how much are these 3 different systems?
Okay, so the 3 different systems, including 100 disposable mouthpieces, starts out, if the Isolite system, is about $2,000 per operatory for the system. The ISODry system, which is exactly the same as the Isolite system minus the light, goes out for about $1,100 for the system. And then the ISOVAC system that fits on the end of the HVE hose, we sell those in a pack of 3 at $900 for a pack of 3, including the mouthpieces. Now, the difference between the Isolite, ISODry, and the ISOVAC is the Isolite and the ISODry have removable heads that you autoclave between every patient, and you'll get 6 of these heads in a system. The ISOVAC is an entire unit within itself that goes on the end of the HVE, and the ISOVAC system has 3 of the heads. Each one needs to be autoclaved between patients, so that's why we go ahead and have 3. 1 in use, 1 in the drawer, 1 in the autoclave.
But where I want to bring the focus on price in, I have an MBA from Arizona State University, and I've seen the finances of 1,000 dental offices in the last 30 years, and you continually see labor 27, 28, 29%. You routinely see a dentist working 2 chairs. with 2 assistants and 2 hygienists, and they'll have a floater assistant. And they're paying a floater assistant, and these are huge wages.
Huge.
And then I go into offices, and they'll have an Isolite, and instead of the assistant, like I say, just frozen there, suctioning the whole time, the dentist is primarily working there while she can be helping, but she's multitasking, she's doing other stuff. And if an Isolite got rid of the cost of a floater assistant or an extra assistant, I mean, the return on investment of this is a 100 to 1.
It's huge, and that's exactly what it does. The Isolite,
and I can see why it would be so valuable in dental school, because a dental school, even when they're charging $100,000 a year tuition, can't afford to give everybody a dental assistant.
Nope, not at all, not at all. So this actually Isolite becomes another employee in your office. It's a $2 per patient employee, or $2.50 per patient employee, because the mouthpiece is disposable. We use it once, we discard it. Never want any risk of any cross-contamination, so that's why I made the decision to go in that direction. So it becomes your $2 or your $2.50 per patient dental assistant. My full-time assistant is there getting everything, as we know, she's there getting everything set up ahead of the procedure. She's there to rinse and evacuate if I need her to, but I really don't need her to do that. You know, I pick up an HVE whenever I want, or a 3-way syringe, and clean everything off. I don't need her to retract the tongue or evacuate. So, as you said, she can be in the other room taking x-rays, pouring models, ordering. The dental assistant has the busiest job in the office. They're the hardest worker. My primary assistant's been with me for 16 years. And I go to do a procedure, and for whatever reason, I don't stick an Isolite in there. She says, "Doc, what are you doing?" Put the Isolite in. Why? Because it makes her job easier and makes my job easier too.
Yeah. So how has your company done? I mean, what percent of dentists do you think are now using this?
You know, I think we have just touched the tip of the iceberg with Isolite right now. I'd say 15 to 20% of the dentists in the United States are using it at this point in time, which still leaves us a wide open market.
But that's huge. I mean, 15 to 20%. I've always said in dentistry, you can sell 1% of any market, anything at any price.
Yep.
I mean, I remember I got to school in '87. 1% of the dentists bought a $50,000 YAG laser. Mm-hmm. But they didn't sell 1,001, and the company went away.
Yep.
No, to have 15 to 20% among a highly educated market means it's the real deal. Because you can fool 1% of the dentists with 8 years of college.
Sure you can.
But you can't, and some people think that you can fool up to 5%, but you can't fool 6%, 7%, 8%. And if you're 15 to 20, it has to be the real deal.
It's the real deal. And honestly, I have to give Dentaltown kudos for that. And this has really been interesting over the years, where Dentaltown has allowed us to go ahead and expand our market, because this is dentist to dentist talking. Well, what do you think about this? What do you think about that? Well, you know what? I like this. I don't like that. And we've had the Townie Awards for the last 9, 10 years now, 11. I mean, it keeps going and going. So it's been real nice in that aspect.
And I'm pulling up the Dentaltown app right now, and I'm going to do the search button. And I just want to tell you, Isolite, Isolite, Isolite. Did I spell it right? Isolite?
Yes, we did. Yeah.
I just did a search for Isolite, and you can't even see how many threads. I mean, you could literally read threads about this for 4 or 5 hours, and it's your fans love it.
Well, you know, it's dentist to dentist saying.
Have you replied on any of these?
Oh, I don't personally reply to them, but yeah, way back in the beginning, we have in the very beginning.
Well, you got a smartphone? You should download the Dentaltown app. And
I'll do that.
And do you have your smartphone with you?
Yep.
Here, give me your smartphone. Do you have the app on there?
Nope.
And pull up your camera. We'll have Ryan take a picture. Now I'm throwing him under a bus. He's got to download the Dentaltown app. Then you got to do a search for Isolite. And on each one of those Isolite ads, you got to drop our picture of us talking and saying Howard's convinced me.
Okay.
Because you have raving fans, and they would love to hear from the founder.
I'll do that.
Here, Ryan, do you have the camera? Here, take a picture on his phone so he can take a. But I think they would. I think it's kind of like a big fraternity, and they would be.
It is a
touched
big
if
fraternity.
It's a big fraternity. Invented this thing. Download the app and post it on the threads.
And here's the deal: the thing that's nice about Dentaltown is it's the real deal. I mean, nobody's selling anybody anything.
Yeah.
So I'll tell you a cute story. As a matter of fact, way back this is 14 years back. 14 years back, my buddy Dave Niebergall that I went to dental school with. Yeah, he says, and he's on Dental Town all the time. He's reading this thing. He says, hey, I'm going to make a posting here. So Dave makes a posting telling us how great Isolite was. And you know what? We get a response. He says, this doesn't smell right. He says, sounds like somebody's buddy's posting something. So the dentists are smart enough to know if something's hitting the fan, if it smells like shit, it is shit. And so they know that.
I would say the key to Dental Town is transparency. Like if
That's
you're
exactly
the
right.
dentist and the owner of the company, you say, hey, I'm the dentist owner of the company.
Yeah.
As long as you're totally transparent, they're
Absolutely.
all cool. But if you didn't disclose you were the founder of Isolite and whatever, then they would say sneaky.
Oh,
but,
they would.
But I think, I know you got to get back to your booth because you're out there talking to real customers in the booth. I just want to tell you that from the bottom of my heart, I thank you for all that you've done for dentistry, for me personally. I think when I first got Isolite, I had vision. But now what year did it first come out?
Came out in 2002.
Yeah, but I would say now that it's 2015, it's not like say I need the light. I need the light and my magnification and the suction, and I just think you're one of those few dentistry who really left the playground better than you found it.
Thank you so much. You know what we want to do is we want to make Isolite standard of care. That's the goal. That's the company goal, is to make Isolite standard of care for dentistry, for procedures, for dental schools, to allow everybody to work in a much better working environment where at the end of the day, we're not frustrated by fighting the tongue and fighting the saliva and saying, God, way back when, I didn't really get the isolation that I needed back there, it got contaminated. I mean, we all go through this stuff. It's kind of the moment of truth as you're working in the mouth, and let's say you're getting ready to cement a crown. You've etched, you primed, you bonded this thing. Now you're getting ready to put your crown in, and the patient swallows, and here comes a flash of saliva coming up, and now the thing's recontaminated. You've got your crown loaded with cement. Moment of truth. What do? Wash it off, blow it off, and dry it, and stick it on, and cure it, and hope for the best? Or do we go back there and clean it off? We go back, we clean it off, but it's time consuming because now you've got to get the cement cleaned out of the crown, got to rebond the tooth, and there's another 15 minutes doing all that crap. And so now with the Isolite, it's there, and we just don't get contamination.
Now,
period.
Do you lecture on this?
No, I don't. Only at the booth.
Does any dentist have a lecture? I mean, is that even a CE course material?
I don't know that there's a CE course. But you know what we end up doing?
Because we have two issues going on. The insurance companies really haven't raised our fees.
No.
And so
We're allowed to do training videos, so we can do a training
yeah, you should do a training video because insurance isn't raising our fees. Yet every trip of this third rock from the sun, the inflation is going up, and we see the overhead has been drifting up for 25 years.
Oh yeah.
And labor is and what I tell dentists is a lot of times dentists will focus on lowering their overhead by putting a lockbox over the thermostat or trying to order gauze online or whatever. But if labor is the 400-pound gorilla.
Yeah, it is.
If your labor variance could be your entire supply cost. Like these dentists will worry all about their sundries. Like who's cheaper, Patterson, Burkhart, Shine? Should I be online? It's like, dude, your labor is 29%, and the guy across the street from you is 24. And if you got your labor from 29 to 24, that'd be like you having your labor at 29 and having Patterson donate all your supplies for free.
Yeah.
And so labor is the one, and no offense to you, but Isolite is more of a play on labor than isolation and light. I mean, you should call it the labor Isolite. You should change the name to, because really, I mean, if this means you don't need that floater assistant, then
not only is it the assistant's labor, but it's the dentist's time. It's your time in the mouth, in the procedure, in the operatory. I will take your schedule and your time and reduce the amount of time that you spend on procedures by about 25%. I'll make you, not that you're working faster, not that you're trying to do anything faster, but the flow goes faster because, one, the patient's wide open, they're well lit, they're dry. You go, you work in the mouth, I start prepping, and I don't stop until I'm done prepping, and I retract the tissue. I'll take the Isolite out of the mouth. I have to check my occlusion reduction, and I'll put it right back in. We take our impressions. When When we do that, we'll put that in for a double bite, then we remove the Isolite and have them close down. But your total time is just reduced by 25% because A, the patient doesn't need to sit up, spit out, rinse, talk to you. You're focused on what you're doing. Ergonomically speaking for you, turn the patient towards you to where you have the best visibility with your best ergonomics. And that's what ends up happening with that aspect. So you're just focused, and it goes faster, not because you're trying to, but just because it does.
And what's your brother's wife's name again, Mrs. Hirsch?
Sandy.
You tell Sandy hello for me.
I will do so.
I think she's absolutely adorable.
Sandy, Howard says hi.
But seriously, congratulations on your invention, and I've enjoyed it for decades, and thank you for coming by the booth and talking to my homies.
Well,
about
thank
your
you
product.
very much, and just from the bottom of my heart, I have to thank Howard and Dental Town for everything that they've done and they've created to make a forum that the dentist can have access to for whatever information they need on a peer-to-peer basis, which is wonderful.
And you're a peer. You're a real dentist. You should make a training. Should make a training video. And you know what? It wouldn't even have to. Who cares if it doesn't get an AGD credit or ADA credit? I think if someone if they could see the real dentist founder, and you made a video about all the uses. And then they're thinking in their walnut brain, my labor is 28%, and why do I have a floater? I think a training video. I think you should do it because
let's do it.
I think if you put a training video on Dental Town, you'd have more individual dentists watch it than 3 days at the Greater New York Dental Meeting.
That's a heck of an idea.
That for sure.
Heck of an idea.
How many dentists do you think will actually walk by the booth at the Greater New York and you'll talk to one-on-one?
One-on-one, I might get 100.
Yeah.
Might get 100.
And the neat thing about Dental Town is it's 365 days a year. You'll go to bed, and while you're sleeping, you'll be talking to dentists from here to Kathmandu.
Oh, and I just have to tell you one more thing. You know what? I'm a wet finger dentist. I'm in my office 4 days a week, except when I'm going out traveling to shows. Why? Because I love it. Dentistry is so much fun. And any of you guys that are working, make dentistry fun. Make it easy. Make it enjoyable. And that's what you do. And if you do that, you last a long time. I mean, I'm going to be 70 in a couple of weeks, and I'm planning on going for another, 10, 15 years, just because it's fun.
Man, you look awesome. You're 70 years old. What's
No, I'm 69.
Are you 69? But you're going to be 70? So
70
what's your, why do you, when I see threads on Dental Town that say, I want to retire in 5 years, and I want to retire when I'm 50, I see it as red flags as burnout, disease.
They're burned out.
I mean, what would you think if a fireman was saying, I never want to put a house on fire, or a policeman saying, I never want to catch a bad guy after age 50?
Yeah,
I'm sitting here thinking, what does money and age 50 have to do with a fireman not wanting to put out a fire, a police not wanting to get... If you told me I was never going to pull a set of wisdom teeth again, I think I'd cry.
Yeah.
So why are you still liking it at 69 and these guys want to be retired by 50?
It's enjoyable. I go in there and there's really... I kind of say this tongue-in-cheek, but I don't think in the last 43, 44 years of doing dentistry, I've worked 100 days where I actually call it work. I mean, we've all had those days that have been really bad and really hard and difficult. But for me, most of my days are in there, somewhat relaxed, enjoyable, and concentrating on what I like to do. I love it. It's fun. It's just fun to go to work.
And I don't understand why would you not want to get a patient out of pain?
Yeah.
Why would you not want to fix a cosmetic emergency?
Absolutely.
Why, when they come in and they need you? I mean, what's going on when the dentist doesn't feel good helping this person? Do you think it's financial stress? Do you think they're looking at it wrong?
I think they're looking at it wrong. I think you're right with that one. I think there's a financial stress where they think, I've got to do this. I've got to make money. Yeah, we all have to pay our bills. Yes, we all have financial obligations that we have to do, but at the end of the day, it's what you do for your patients to, as you said, to help them, to take care of them. I go in anytime a patient calls and they have an emergency, whether it's an aesthetic emergency or a dental painful emergency, I'm there. And being available for your patients really makes your practice grow. They know they can count on me, so they come. I've got some friends, where they question the emergencies on weekend. If it's an emergency in the patient's mind, it's an emergency.
So I don't want to. I want to tell you and Hugo one story why I have to get a training video on it. I don't want to tell the country because I don't want to make a country feel bad. But as we know, there's 220 countries, and 20 of them kind of do dentistry like we do, and 200 countries are more poor. So I have seen this in 3 different countries, in very, very poor countries. There's no dental assistance. A lady comes in, she's wearing a veil and sari, and she exposes, and she's concerned. She shows the dentist a spot. So he numbs it up, he's preparing it, and when he goes to do the bonding agent, he puts the bonding agent on it, and she did not like the taste, so she sat up, swish, spit in the bucket. And then she went back, and he went to the next step. And then he cured it, and she didn't like that taste. She sat up, rinsed, spit in a bucket, and then went back, and then he put it on the composite, light cured, then finished it. And I'm just standing here like,
Ooh.
Wow, I've seen this 3 different countries.
Wow.
The point I'm trying to make is there's no dental assistance
Wow.
in poor countries.
No.
I mean, there's really not that much, or I haven't seen. And so I think Isolite is a huge return on investment in rich countries where labor is very expensive.
Yep.
But it's even clinically mandatory minimum in poor countries. So I hope that dentists watching around the world realize that contamination is everything. And if you're doing composite, that's why I like amalgam. Yeah. And that's why I don't like dentists bad-mouthing amalgam in rich countries, because then poor dentists in poor countries hear rich dentists in Star Wars America bad-mouthing it. Yeah. So they switch to composite, but they don't have the isolation. They don't have the dryness. And amalgam is so technique forgiving.
It's very forgiving. It's very forgiving.
You can be the worst clinical dentist in the world and probably get a C+ or B- on your amalgam.
Absolutely. It's going to stay.
But man, isolation in other continents is pretty scarce, and you could really have a big help there.
Well, what we're doing right now is we've gone international. About 2 years ago, we've gone over to England, the Benelux. We're now in Belgium, Luxembourg, the Netherlands, England, France, Spain, Germany, Austria, Australia. So we're branching out internationally.
But those are all the rich countries that can do isolation.
Yep.
Those are the rich countries who would like it, and it's free of labor.
But even so, not even necessarily the rich countries. They're the countries where dentists don't have assistants. Yeah. And so the ones that don't have the assistants, this becomes their dental assistant. So training. And you are right, though. It is the rich countries too.
My point in all this is that we should do. He's a dentist. He's a homie. He should do a training video.
We should do that, showing all different ways you can use it. And that's gonna be great.
Yeah.
We'll do it. Let's just set it up. Thanks, man.
All right.
Howard, appreciate it. Howard. Thanks, guys.